Hello, everyone, and welcome to another episode of I Got You podcast. This evening, our topic is What's Up, Doc? My name is Keisha, and I'm here with my co-host Heather and Renee. And today, we have a very special guest joining us today. Her name is Dr. Kathy Yawingu. Dr. Kathy is an internal medicine physician and health educator who's excited about the healing power of a positive lifestyle choices. One of Dr. Kathy's motto is health is wealth. And she believes that positive lifestyle changes practiced every day are more powerful than any prescription pill to maintain health. Dr. Kathy will help us today to answer some questions surrounding health, especially within the Black community. Once again, welcome, Dr. Kathy. We're happy to have you. And we'll just get right into it.
Okay, thank you so much. I'm glad to be here with you guys.
Awesome. Our first question today, Dr. Kathy, is, based on your experiences, what are some of the health issues you see affecting our Black community?
Oh boy, that's an issue that's so it's so complicated because our people suffer from many lifestyle diseases, and unfortunately we suffer from them worse than our white counterparts. So the most prevalent disease in the Black community is really hypertension. That's the most common chronic illness. And after hypertension, it's cancer. And we get these diseases far more frequently and more aggressively than white people do, and we don't do well with it most of the time, or with them. So a lot of the issue revolves around or poverty or lack of education, so many factors that really affect our people.
Wow. Okay. And so hypertension, do you think, because I know on your website and you kind of for your diet, do you think that has something to do with it, or diet as a Black race, what we consume every day?
Yes. For many years, we've been taught in medical school that Black people have certain diseases because it's their genes. They have high blood pressure because it's in their genes. The diabetes is because it's been in their family for years. And so we've learned to accept this as something that's going to happen to us, and we pretty much expect to get these diseases.
Wow.
But within the last decade or two, or even three, we've realized that that's not the truth. We've been sold a bunch of lies because these are lifestyle diseases and we do not have to get them. Now, what does lifestyle disease mean? Well, it means that it goes way beyond your genes or, what's in your family. It really, you get them based on the choices you make every single day, what you choose to eat, how much we choose to move, how much we allow stress to impact us and really, drive us crazy. All these things affect our bodies and lead to disease. So we're realizing more and more that if our Black community is well educated and has the right support to take care of themselves, we don't have to suffer the way we are from these illnesses at all. So yes, there is hope for change once our people are more empowered.
That's great. Okay.
All right, Dr. Kathy, I do have a question, right? I've realized that a lot of Black people are lactose intolerant.
Yeah.
Is it something that's genetically in us that we can't process the lactose?
Yeah, you know what? That lactose intolerance is because we are normal. Normal people are lactose intolerant.
Right.
Now, what do I mean by that? Well, every mammal, like a mammal is an animal that produces milk to feed their baby, their infant. Every mammal that makes milk has lactose in the milk. So cow's milk has it, mom's milk has it, every mammal milk has it, mammalian milk has it. And so infants from birth to about 2 to 5 years old, they have the enzyme needed to break down lactose. It's a sugar that has to be broken down. But as we get older, we lose that enzyme. That's a natural process of just growing up. We lose that enzyme, and there's no need to consume milk anymore. And so whenever someone drinks milk and they don't have that enzyme to break down the lactose, then they get, the sugar gets in the colon and gets fermented, and they get bloated and gassy and diarrhea and all these uncomfortable feelings because they're not meant to have the lactose in their colon. And so being lactose deficient, not having the enzyme to break down lactose is actually a normal occurrence. And you find that in about 70% of the world's population. So all through Asia, South America, Africa, people don't drink milk, but when you come to like America and, North America and Europe, about 20% of those individuals have retained, more than that, sorry, almost half of them have retained that enzyme. And so they can drink milk, and they do, and it's pushed big time in this country. All the dairy is pushed so hard because the Caucasians can tolerate it better. But Blacks, Asians, people in South America, they do not have the enzyme for the most part. And so that's a normal thing.
Wow. Yeah. So why do they push it so much with babies then? Like we have to give our babies milk and whole milk and everything like that.
Yeah, it's about money, marketing, the slogans, milk does the body good, not the truth. And I know this sounds really, this is like a shock to many people. Like, what? Milk seems like the perfect food, like it's essential. But it's not. When you travel, when you look across the world's populations and at the healthiest people, they're not drinking milk. They're walking, they're eating fruits and vegetables, they're hanging out with their families, their stress level is low. Yes. They live to 100, they're healthy. They don't have any milk, any great amount of milk, maybe a little bit here and there, but not a lot like it's being pushed here. So it's really a marketing thing in this society that we find ourselves. But on a more serious note, we should never give babies cow's milk. A baby's best food is mom's milk. That's so important. And if a mom cannot or chooses not to breastfeed, because it's her choice, some moms don't want to, then at least get a formula that's soy. Don't get a formula with cow's milk. Your baby's just going to be gassy and uncomfortable and up all night. So get a formula with soy. That'll be much better for the baby.
Yeah, and for me, at my age, milk, I am gassy. I'm bloated. It's bad. Like it could not be good for you if it's having all those effects on your body. It's just not. And I see more now in my early 40s.
Wow, I would never have guessed. You look like you're barely 20.
Like, we'll take it.
Yes, but no, really milk is not the best food. And if anything, I want our listeners and viewers to really revisit that topic. Should I be giving my children milk? Do we need cow's milk? You can always replace with a healthy alternative. I push big time to all my patients, get a nut milk, a seed milk. They're everywhere now. Almond milk, soy milk, rice milk, oat milk, it's all over the place. It's lower in fat, which we don't need so much of. It's lower in pus and antibiotics. And I know that wasn't a pleasant thought.
But it's the truth. It's the truth. Absolutely. It's the truth.
Yes. But are people really be better off just not consuming milk? And what gets people is that when you say stop drinking milk, it means stop eating ice cream and
I know.
yogurt and cheese.
Yes.
I know, and that's the tough part. People can put milk aside and get almond milk, but no ice cream. That really is a tough one. But when you're trying to really, Heather was like, "All right, I've heard enough of that one." But really, when you're trying to assess how can I get my best health, how can I help my family to flourish with the best health possible, you have to start looking at the dairy products and trying to replace them with plant alternatives. It will go a far way.
That's great. Okay, thank you. Okay.
So, what do you think are so many Black people deficient in vitamin D, and what are the symptoms of, and how do we prevent it?
Yeah. So, vitamin D is so important for health. We are discovering more and more how important it is. There's a vitamin D receptor on every cell in your body, which means that it's a part of almost every function. You find it on white cells for the immune system. You find it on nerve cells, on hormonal organs. You need it for everything to function well. And so we know it's important. How do we get vitamin D? Well, it's not found easily in plant sources. We really were meant to be out in the sun. When you go out in the sun rays hit your skin, and then there's a reaction that occurs within your skin with cholesterol and the sun rays that forms vitamin D. And then it goes into your bloodstream and into all of your, throughout your blood, and gets to where it needs to be. And so if you're not in the sun a lot, you're not gonna get adequate vitamin D. And many of us don't really find ourselves in the sun much. I don't know how much sun you ladies got today, but I didn't get a whole lot.
Right. That's so true.
So we don't find ourselves in the sun a lot. That's the first thing. And, because we just have busy lifestyles, we're inside a lot. We work inside. We're always doing something inside. And where we live, if we're in the northeastern hemisphere, we don't get sun that much all year round anyway. In the winter and in the fall, it's not that sunny a lot. So, we weren't really supposed to be in this atmosphere. When we're in our motherland, we get sun all the time, and we're out there and we get our vitamin D. But when we're here in the northeastern hemisphere, we don't get the sun we should. We aren't outside, and so we're deficient. And also, the more melanin you have, that's the pigment that gives our skin that beautiful hue. The more melanin that we have, the more sun you need to convert vitamin D. So, for example, if you're a very light-skinned person, you only need about 15 minutes in the sun to get 5,000 or 10,000 international units, which is a good amount. That's all you need for the day. If you're a medium complexion person, I'm gonna guess maybe, like Keisha, I can't tell for sure, but medium complexion, maybe you need about 30 minutes in the sun every single day. So that means going outside, exposing your face, your arms, your neck to the sun and getting it. But if you're a dark-skinned person, like a really dark-skinned person, you need like 45 minutes of sunlight every single day. And you have to be outside, not getting it through the screen, the glass of the window from, your office or the car. You have to be outside and get direct rays. And so, it requires a lot of thought, planning, and effort to get the vitamin D that you need. And so, we are much more deficient than everybody else here, pretty much, in this country, or in America, because your audience is probably wider than America. So those in America certainly have a very deficient, and that's a problem, because being vitamin D deficient has been shown to be linked to many illnesses.
Yes.
Vitamin deficient women have a higher risk of breast cancer, higher risk of infections, sniffles, colds, flu, COVID. We can't fight things as well. So vitamin deficiency really has significant impacts. And apart from the cancer and the infection, also bone pain, soft bones, and more fractures. So, it's significant, and we have to pay some attention to it. If you can, get outside. That's really the best way to get your sunshine. But
so,
if you can,
So the other alternative is also, because that's what I've been told, to take vitamin D tablets.
Yes. Or vitamin D3.
That would be a better, or D3, right?
Yeah. So I try my best to get outside as often as possible, and but I'm still deficient. You know, I check my vitamin D maybe once a year or every other year, and if you're listening, really you should ask your provider to add vitamin D to your blood work panel. You want to know what your D level is. It's something that you should ask for, especially if you are an African American. So get your vitamin D checked. If it is low, you need to do something about it. Go out more often. If you can't, take a supplement. I take about 5,000 units every day in the liquid form of D3. D3, D2, you know, either one you choose, but you need about 5,000 units, international units a day to be on the safer side.
That sounds good. So we're going to shift gears a little bit. And I wanted to talk about some of the most infections in women are said to be bacterial vaginosis and yeast. Can you explain what is yeast and BV and what are the symptoms and just the main differences that you see between those two?
Sure. So first of all, bacterial vaginosis and a yeast infection, they're not STDs. They're not sexually transmitted diseases. So nobody has to feel bad or ashamed if they have either of these things. The vagina naturally has bacteria. You know, you have bacteria there that are functional. You have good and you have bad bacteria, and they're serving a purpose and keeping the functions going properly. Whenever we have an imbalance of those bacteria, so the bad bacteria rise up and the good bacteria are squashed, you get anarchy, so bacterial vaginosis, too much bad bacteria in the vagina. And so that's from a bacteria, whereas with the yeast, it's a different organism. You know, yeast lives in the vagina naturally also, but when the pH or the chemical balances are not accurate, the yeast kind of rises up and takes over and starts to proliferate, and you get a yeast infection. Now, they present very differently. With bacterial vaginosis, first of all, it's common. About 1 in 4 women will get it. And it can be caused by many things. But before I go there, the presentation is itching, some burning, a thin discharge, you know, like a whitish, grayish, bluish discharge. Sometimes a fishy odor, and you're like, whoa, what's going on there? You know, that can be that can be one of the symptoms. We call it the whiff test. When you go to your doctor, they take a whiff, and you're like, there's the fish, you know. So yes, some women, it has no symptoms, so you can have BV and not even know it. It just kind of goes away because it can resolve on its own if you change, you know, the environment a little bit. So you know, BV is often not a big deal. It can be a big deal if you're pregnant. If you're pregnant, you need to get it taken care of because it can lead to problems with your unborn baby. You can have preterm babies, can come up too early, too small. So it's important when you're pregnant, for sure. But that's the difference. With yeast infection, that's a whole different beast. I mean, if you've ever had a yeast infection, it's extremely annoying. I've had my own share from taking antibiotics, and the antibiotics kind of kill out the good guys, and then the yeast just takes over, and it is so itchy, you know. It's extremely itchy, and you get this discharge that's not thin and light. It's like this cottage cheese, yellow, gunky, yucky stuff. And it's very uncomfortable. So if you've had it, don't be embarrassed. You know, it happens to anybody. You know, it's really not a big deal, but you have to get it treated. That one, you have to get it treated, and it's easy. A simple pill, boop, it's gone. It's easily treated. So just go to your provider and tell them what's going on, and they can help you get rid of it.
That's great. Good to know.
So, Dr. Kathy, that's one of the things that why we wanted to ask about BV and yeast, because a lot of men, when they find women that have that fishy smell or they're having sex and that smell comes, they start thinking that these girls are nasty, or that they're promiscuous, or that they do have an STD, right? So how do we even have those conversations with the men that we have in our lives and everything else? Because it's also an embarrassment, I guess.
Yeah.
Talk
Well,
about it.
Yes.
so for the woman listening, first of all, don't be embarrassed and just try to educate your partner and be like, listen,
Yeah.
this is this is not an STD. You
Let's
know,
educate them.
yeah, exactly. Let's help them to understand because we don't want them to make us feel less than when it's not our fault. We're not less than. We just have a little thing going on that we, are going to take care of, but we need their
Yes.
sympathy and understanding. When you have a yeast infection, you need to hold off on sex. It's just too
Yeah.
uncomfortable to do that when you have that yeast growing there. So just let them know it's not an infection. The pH balance, the environment of my vagina has been altered because of, don't even give any reason. It's just been altered. And I'm going to get it treated and it will be gone.
Right.
But I need a timeout for a few days
Right.
because this has to heal.
Absolutely.
So, so it's important for the woman, first of all, to realize that we need to know our worth first and explain to them,
Right.
this is what's going on. Don't let them determine our worth and
Right.
what's going on with us.
Right.
So that's the first thing I would say.
Wow. Can you also get it? I know there's a myth. Can you get it if a man has more than one partner? I don't know if that's true or not.
Yeah, I've heard that.
Yeah, so usually, no, with bacterial vaginosis, the causes can be if a woman has a new sexual partner, so his chemical stuff changes her chemical stuff, and then she gets that infection. He didn't really give an infection, but just the pH and the chemicals and the environment has changed because he has introduced a different environment pretty much. Or if the woman has many sexual partners, so multiple exposures, that's one cause, but not necessarily the cause of BV. And when it comes to BV, there's so many different factors. Can I take a minute to just give some tips on how to keep your vagina healthy so that you don't have so many infections?
Oh yeah, I need a healthy vagina. Yeah.
Yes, so for those of us listening that have vaginas, listen up, okay? Listen up. The way to have a healthy vagina, I'll give you 10 tips for a healthy vagina so that you can have less BV and yeast and all of these annoying experiences. First of all, don't douche. Douching is not shown to be helpful. You know what happens?
Right.
When you douche and you're trying to clean internally, you're removing the good guys, and now the bad guys are like, yes, we'll take over, and you have a higher risk of infection. So don't douche. Just leave it alone. The vagina is a self-cleaning organ. She takes care of herself. You don't have to be cleaning with any douche products. When you clean the area, just use water and gentle soaps, and don't try to get inside. Just the outside areas is all you need to clean the vagina. Also, don't use scented products as much as possible. Scented tampons, scented pads. Don't spray scented perfumes up, inside of you. Just don't do it. Too many chemicals. Too many chemicals. The vagina doesn't need all of that. So don't spray those things inside of you. Avoid tight underwear and really tight pants. That your organ wants to breathe. So when you have really tight, constricting
I feel like
clothes,
Dr. Kathy's preventing me from being sexy. I'm just saying.
No. You know what? You gotta weigh the risk and the benefits and the risks. So if you want an evening of tight clothes, go ahead. But it should be your what do you call it? Your MO, your everyday thing. Your clothes are just like so tight. What is it called? Modus operandi.
Right.
Yes, you really want to give some time to breathe. Also, you wear underwear that has a cotton for the crotch part so that you can have a more breathable material. And when you go to bed at night, consider like tossing the undies, just freeze. Just be free.
Take the bra and everything else, right?
Yeah. Yeah. We shouldn't sleep in our bras. It's not good for our breast health at all. So when we go to bed at night, we should really be free and just that's natural. Give your organs time to breathe and to be dry, not to be moist and humid.
Okay.
Change your tampon every 4 to 8 hours, or your pad. Don't wear it for a very long time.
Okay.
And wipe from front to back, please. Always front to back, never from your butt to the vagina. That's a sure way to get infections. And I think, and get to know your vagina. Take a mirror, look down there.
Yes, honey.
Yeah. Look down there, just be familiar with your own body, so that when something abnormal happens or the smell changes, right away. It's good to have your doctors, but we need to be familiar with ourselves, doing our own breast exams, looking at our vaginas every now and again with a mirror to make sure that things look, okay. And also, don't remove all the pubic hair. The pubic hair is there for a reason. And when you start shaving everywhere, shaving everything, you get
Dr. Kathy, we need to talk again, Dr. Kathy, again. So I'm gonna have to stop.
Oh, really?
Listen.
What did you say, Renee? I missed that one.
McCann wax. Jeez.
No. I didn't say. No, it's okay to, if you wanna have a nice appearance and shave the bathing suit area.
Yeah.
So you're not like all fluffy and everything's coming out. But where the pubic hair is protecting your actual vagina, the inside part, there's no need to take that all out. It's there for a reason. Decrease the entry of different bacteria and then so we don't think about these things all the time, but really now your hair is there for a reason. Don't remove all of it, especially not where the inside part is. So those are a few tips for a healthy vagina, and I'll stop there on the vagina bit.
Well, we need that.
Those are great tips, by the way.
Right, yeah. Those are good. So as it relates to that we eat, so what foods should we avoid? What foods do you encourage us to eat when it comes on to our vagina and bacteria and yeast and BV?
Yeah. So one thing that you'll see about the message I try to push every single day is that our diet really is best when it's plant-based, unrefined, unprocessed. Now, some people don't like the idea of giving up meat altogether, but meat should be a condiment, as in a side, not a main course.
Right.
That's been a part of how we've gotten so sick. We're eating a lot of meat because we can afford it. It's everywhere. And we're eating very processed. So instead of eating apples as apples, we're eating apple roll-ups and apple pies. And instead of eating potatoes as beautiful potatoes, we're eating potato chips and potato fries and every other form besides just a regular baked potato. We need to have an unprocessed, unrefined, plant-based diet. That will really help because in that diet, the sugar load is decreased. You're not having lots of cookies and pastries and candies, which yeast loves. A very high sugar diet with lots of white flour, it increases your chance of yeast infections. Yeast just loves sugar. So when you have a lot of yeast, decrease your sugar intake significantly, your processed sugar intake, which means eat sugar in a fruit or, eat it in a sweet potato, but don't eat it in like ice cream or, where you add sugar to stuff. That's bad news for your vagina and your whole body, actually. It really is bad news.
Okay. So let's move on from the vagina to the penis. Okay?
Oh, boy.
Because the penis is important. So what is erectile dysfunction and what causes it? That's the first question. And what is the age range that men experience it, and what can be done about it, pretty much? So what is it?
Sure. So erectile dysfunction is when a penis cannot sustain firmness to complete a sexual act, right? The penis just can't stay firm. And it is very distressing to males. And so it's a big problem, and we need to talk about it, because you know what?
Yes.
The men aren't talking about
They're
it.
not.
They don't want to tell anybody about it, but it is driving them crazy, because it's so integral to how a man sees himself and how he feels about himself.
Yes.
And when he has this problem, he just, you know, really doesn't know what to do or who to tell. So first of all, if this can happen to any male, it doesn't have to be because of a big problem. You know, if a man drinks too much alcohol one night, you know, he may have a hard time having an erection, or if he's having some stress in his life, he may not be able to sustain an erection. But if a male has this issue for more than 3 months and he just can't, you know, shake this problem, he should see his doctor, and they need to have a discussion. Because what men may not realize is that the most common cause of erectile dysfunction is physical, not mental. Years ago, we thought, you know, it's just in your mind, you know, you need to get over it, it's in your head. And that can be a cause, but the most 70% of erectile dysfunction is physical, meaning there is something limiting the blood flow to the penis. There's not enough blood going there. And if there's not enough blood going to the penis, guess where else could be suffering? The heart.
Wow.
There's not enough blood going to your heart. So men who have erectile dysfunction have a high risk and very likely have problems with blood going to their heart and are a heart attack waiting to happen. So you cannot think that it's just all about the penis. No, your heart it could be involved too. So you really got to address this. You can't ignore it.
Oh, wow. That's a good point. Wow.
The blood flow throughout the body is being affected. There are many different reasons. So I said physical is one, and physical could be one, the blood is too thick, you know, so that it's not flowing to the penis well. What makes your blood thick? Too much triglycerides. Where does that come from? Too much oily, fatty food, too much red meat. You know what? Or men, they love the red meat and they think that, you know, I think there are ads that say real men eat beef. Well, real men who eat too much beef won't stand up. You know?
Write that down.
You're not gonna be able to get it up there. So you really have to reevaluate your diet. If you're a male listening, or if you're a female listening who has a male who has erectile problems, really try to go easy on how much meat you're putting on his plate, how much oil you're putting in his pot, how much bacon and fatty stuff you're giving to him. The more fruits and vegetables he eats, the better his chances are of getting better blood flow to his penile area. So really, it could be the diet, too much cholesterol, too much fat, also diabetes. You know, it's diabetes affects every organ in the body, and the penis is not left out. And when a male has, it's for real, diabetes sucks, you know. And the good news, though, it is reversible. If you are listening or watching us, please remember these words. Diabetes is reversible. When I was in medical school, we were taught you can't reverse it, you know, just manage it forever with pills and insulin and, you know. But no, we've discovered now that with a proper diet and lifestyle, you can get rid of that disease. It just requires the proper education and knowing what to eat and how to eat. And I'll just leave this little tip. A plant-based, unprocessed, unrefined diet linked with good exercise and stress management can really help you get diabetes under control and maybe even gone. So diabetes is one thing that affects the penis, and you know, it decreases the nerve sensation, the blood flow, and that can affect proper erections. Also, obesity, which is growing in our community, and so that affects it tremendously. Also, medications. Some men have to take medications for high blood pressure. That does affect their sex drive, their performance, and also stress. We're in a stressful time, you know, unemployment and family issues. Stress affects how well the penis will be erected. So those things are serious, but they can all be addressed. So don't be afraid to talk to your provider. Talk to somebody who can help. And once you can find the cause, guess what? You can probably take care of the problem.
Dr.
Thank
Kathy,
you. Yeah, that's
you already
great.
answered my question. I was going to ask you is, can a lifestyle and diet change a person's with ED? You just already answered that.
Yeah.
But one question I have to ask, does lower testosterone also affect that too?
Yes, thank you for bringing that up, because I did mention that, and that's important. So physical things, like I mentioned before, psychological issues, hormonal issues like low testosterone will affect the performance of how the penis works. And so that's important too. And as when men get to about 40, 50, sometimes the testosterone level can start to decline, not rapidly, but slowly over time it can. Most men don't really notice a change because they don't have any big symptoms, but some men will notice the effect of lower testosterone. Also, substances like alcohol, tobacco, those do affect how the penis functions. And if you're a male and you're having erectile dysfunction and you smoke and drink, really, really, really try to get rid of those habits. They're really bad habits that affect you all over. They affect your heart, which is the #1 killer in this country and in our population. They affect the penis, and I know that's what's going to motivate you. So if it's for your penis, just stop smoking,
Right, absolutely.
Do it for your penis, but stop smoking.
Do it for your penis.
Really.
The new slogan, do it for your
penis. We're going to quote
do it for your penis.
And that will take off because men will jump through loops for their penis.
Right.
It's true.
So I know a lot of what we talk about as it relates to women experiencing hormonal changes and stuff. You never yet that men experience hormonal changes. So could you speak on that from the standpoint of men and hormones? We just talked about testosterone, but in general, are there other things that we need to consider or men need to consider to let them know that, listen, they also experience hormonal changes as well?
Yeah, sure. So definitely, women, when we are in the menopausal stage of life, we have like a drastic decline in essential or hormones, and we feel the difference. It manifests in many different ways. Men are different. They also have hormonal decline over time, but theirs are more gradual, over years, so they won't necessarily have any drastic changes like we do or we experience as women, but they do have hormonal decline over time and changes. And so lifestyle, really implementing a healthy lifestyle, a healthier diet, higher in fruits and vegetables, engaging in regular exercise from a young age and continuing into older life does help with proper balancing and maintaining a healthier hormonal level. Definitely.
Okay, that sounds good. So Dr. Kathy, so recently I heard of a situation in which a guy had a prostate exam. And during that prostate exam, he ejaculated, right?
Yeah.
And it didn't turn out too well for the doctor.
I know.
So my next question, and the last round of questions, I want to talk about the prostate. And what is the prostate and why is it important in men?
Yeah, sure. That's a great question, because most men don't really know much about the prostate and where it is and what it does and why it's so important. It's like a weird term and they can't really see it with their eyes. So the prostate, the prostate is like the size of a walnut. It's quite small, and it's in front of the rectum and beneath the bladder, and it kind of not wraps around, but it kind of abuts or pushes against the urethra where the pee comes through. So as men age, it grows, it gets bigger. It is very important because it produces the fluid that semen needs to flow through. You know, that when men ejaculate, the prostate plays a big part because it's helping with that fluid to go through there. So it's important as part of the male reproductive system. Ways for men to keep their prostate healthy, again, goes back to a healthy diet. Because when the prostate isn't healthy, it leads to a lot of discomfort for the men, you know, affecting the way they pee. For example, if the prostate begins to grow, which happens by like age 40, 50, 60, it starts to press on the urethra. And so peeing is strange. Like they're peeing all the time, or they're dribbling, or they can't empty properly. And so they have a lot of issues with peeing. And it's not uncommon. And so if that happens to you as a male, tell your provider, because you want to make sure it's just what they call benign prostate enlargement, or benign prostatic hypertrophy, BPH. And that's not, you know, a big problem, except that, you know, it's annoying, you know, and there are meds that can help that. But big tip, zinc. Zinc is important for the prostate, especially pumpkin seeds. A lot of studies where men with enlarged prostates eat pumpkin seeds every day, and it helps the prostate to behave itself. So that's a tip for or men. We like to say zinc for men, iron for women. You know, ladies, we need the iron, the men need the zinc. But yes, the prostate is very, very important. And so a proper diet is very essential for men. Eating foods like tomatoes, a top food for your prostate, man. Tomatoes, not in tomato ketchup. I don't recommend that. That's not on my prescription list. But eating fresh tomatoes, you know, sauteing them, cooking them, you know, marinara sauce, high in lycopene. The prostate loves that, and it helps with the fluid formation and flow. So tomatoes are great for the prostate. And like I said, pumpkin seeds, number 2 for the zinc. And zinc increases testosterone also. You can tell I love food as medicine, right? I believe that food is medicine. Love it. I love talking about how food heals the body. And other things like spinach, you know, high in magnesium, that helps the penis, you know. And so you eat more spinach, it helps Popeye, it helps your penis too, be nice and strong. Right. So foods like those are good. Carrots are high in a certain compound that help the prostate be healthier, helps to fight prostate cancer. Apple peels also help fight prostate cancer. Oats help relax the blood vessels and help make erections harder. So these are all natural foods that help our men to have healthier prostates and penises.
That's good. And you know, Dr. Kathy, one of the reasons we're doing this podcast as well is because Black men have a problem going to the doctor to get their prostate checked for whatever reason they make up in their mind. And we just wanted them to know that it's important to do so. And also the fact that even in the situation that just happened, it's possible that when you have a prostate exam that you can ejaculate, because I think we need to educate the men that these things can happen, and that don't get upset. It's a medical thing and not something else. It doesn't mean that, So that's why we wanted to educate them and to let them know the importance of getting your prostate checked. And some of the ways to make it healthy.
Yeah, it's super important. You know, when a Black male turns 40, you need to be all over your prostate, because you do not want to get prostate cancer and catch it late. You know, if you catch prostate cancer early, your chances are really good that you'll do much better. But if you ignore your prostate, you know, don't get it examined, don't get it checked, don't get your PSA tested, just don't go to your doctor, period. And then you happen to have prostate cancer later on, in 45, 50, it's just far gone. And it makes it very tough. Black men do worse with prostate cancer. And I don't think it's because they have bad genes. It's because, you know, of just lifestyle choices and delayed care. A lot of our problems in the Black community is delayed care. We don't get the proper follow-up. We don't get the early diagnosis. You know, we don't really know what to get checked at the proper age, time, milestones, and we do worse. And so if you're a Black male listening to us, and if you are close to 40 or at 40 or past 40, run into your doctor's office and be like, please check out my prostate. I want to be here. I want to be around, and I want to be healthy.
And to talk more about that, in terms of the milestone of being 40 and checking your prostate, are there any other milestones that men need to pay attention to, and other health issues in terms of those milestones that they need to pay attention to?
Oh yeah. So from did you guys know that the population that consumes the most amount of fast food in this country is young Black people?
Oh, wow.
Black youth between 20 and 49 eat the most fast food in this country. So I bring that up to say, if you are a young Black male, you're 20, you're 25, there are no real big milestones yet for you to address with your doctor in terms of checkups, but you need to leave the fast food alone, please. That is not real food. That is slave food. You need to eat real food and start getting into a habit of eating fruits and vegetables. Why? For long-term health, for your skin, your penis, your heart, for everything. You need to start doing that now. When you get to your 30s, start keeping a close eye on your blood pressure, because that's when blood pressure starts to hit the Black male. Early 30s, start having your blood pressure checked every time you go to the pharmacy or wherever you see a blood pressure cuff, in the community, get it checked. And when you go to your doctor, of course, have that checked. When you get to, if you have a history of prostate cancer, in your family at 35, you want to start pushing, can I start getting checked? Make sure I'm not going to get this. When you're 40, for sure, Black males, start having your prostate checked. When you're in your 50s, when you get to 50, it's time for that first colonoscopy. Unless you have a history in your family of polyps and cancer, then do it even earlier. We have examples of beautiful Black stars that have fallen from colon cancer. And so we want to try our best to just stay ahead of it if possible. So when you get to 50, for sure, you need a colonoscopy. And all along the way, you want to have certain things checked, like your cholesterol, keep that under control, your blood pressure, and your hemoglobin A1C. What is that? For diabetes. You don't want to get diabetes going rampant. So have those basic, and your vitamin D, have those basic things checked as you're progressing in life.
Awesome. I think
that's great. Heather, do you have a question? I saw that you were about to say something.
No, I was going to ask, with the prostate, since they don't want to get tested for the prostate, right? Is there blood work? Can they do that to start getting an idea?
Yeah, sure. So the Urological Society isn't as strict with the digital rectal exam anymore. Hi! I thought he was asleep. So you don't have to have that. Talk to your doctor. Some doctors, it may be essential in some cases, but there is a blood test, a PSA test that can be used. There are pictures that can be taken. So it doesn't have to be the rectal exam, but your doctor will decide if you need that part as well.
Okay. Like that. Thank you.
Those are such great topics. Okay. Does anybody have any more questions for Dr. Kathy?
No, I think this was so awesome and exciting. Thanks, Dr. Kathy.
Look, I learned a lot.
I know.
Oh, no.
Dr. Kathy.
What did you say, Keisha? I didn't hear that.
No waxing, no nothing. I'm just kidding. But it was great. But so we have a segment before we end our show, is we talk about gratitude, and we ask our guests what are they most grateful for, and that's what I'm asking you. What are you most grateful for?
What am I most grateful for? Well, I am really grateful for I have to pick one thing, right?
One thing. One thing. That's why it's so difficult. It makes you think, right?
Oh my goodness. Oh, that's not fair. Okay. I'm really grateful for mental health.
Awesome.
Mental health.
Because
Thank you.
it's difficult when that's not there. Mental health.
Right.
Great. Well, this was a great episode. We're just happy that you decided to join us. Before we leave, can you tell us your social media handles for the audience?
Oh yeah, sure. So you can find me in a few places. Instagram at Wellness Dr. Mom. That's WELLNESS Doctor DOCTOR Mom. And that's Instagram. And then for my website is Wellness MD. Wellness MD Mom.
Okay.
And for YouTube it's Wellness MD Mom. And Facebook is Wellness MD Mom.
Oh, great. Well, Dr. Kathy, do you have something, Heather?
Can I ask one more question? On these websites, do you give food on what people could eat also to fix some of these issues that we just talked about?
Yeah. So my aim is to help folks just feel better, look better, have a healthier family with food, and so I have a blog that I publish that talks about different aspects of food, and the YouTube channel that tries to teach how to make different foods in the kitchen with your kids, because it starts from their kids. If you get them eating healthy early, they'll likely just remain healthy eaters.
So true. Absolutely.
Well, thank you again, Dr. Kathy. It was so awesome having you. We really appreciate you. We appreciate your energy and your information. You can find us on all social media platforms at I Got You Podcast. This has been an awesome show. Thank you for joining us, and we'll see you soon.
All right, then.
Bye. Thank you so much, Dr. Kathy.
You're welcome. Bye.
Bye.